Rafferty, Professor of Health and Nursing Policy at King's College, past President of the Royal College of Nursing. Dame Anne, a very good morning to you. Welcome.
Good morning.
Thank you very much for talking to us. Now, I don't know what you made of what I just had to say, but would you agree with any part of it?
No, I wouldn't agree with your diagnosis at all, actually. I mean, okay. I think many nurses are only doing this as a last resort. No one takes this action lightly, and it's been an agonising decision for those nurses that I've spoken to. And I think it would be the same for ambulance crews as well. I mean, nurses have just been pushed to the absolute brink. They've seen a 20% reduction in the value of their pay packet since 2010. And it's not just about pay as well. It's about other issues to do with working conditions and specifically staffing.
Right.
And I think this action is actually designed to stop matters getting even worse, because I think many nurses are just so worried about the standards of care that they're actually able to deliver to patients. And this gives rise to something called moral distress, where nurses just feel they're put in an impossible position and they can't really do the job that they've been educated, often to degree standard, to actually do. So it's a huge issue.
Yeah, it is a huge issue, but an awful lot of people have made this argument that you're making about the fact that conditions are terrible, that there's a shortage of staff. But what precisely is the shortage of staff? Because we're told as well, £3 billion a year is spent by the NHS on agency nurses. Now, those agency nurses, some of them are agency nurses because it suits them better. Some are agency nurses because they can make more money doing that. Some were former NHS nurses who have left the NHS. So those agency nurses are doing the jobs, surely, that the shortages are allowing.
Well, they're not, actually, because agency nurses can only be called in after a very rigorous process of escalation, and quite frankly, as a last resort in staffing. Many trusts use their existing staffs who do extra shifts known as bank nurses to actually fill rostering gaps. And in fact, research that we've conducted, also in conjunction with the Institute for Fiscal Studies, has actually demonstrated that agency nurses are not equivalent substitutes for well-trained, registered nurses who actually work regularly on their own shifts and their own wards.
Well, why is the NHS wasting £3 billion of taxpayers' money on them then, if they're not fit for purpose?
I'm not saying they're not fit for purpose. I'm saying you just don't get the same kind of value from people who are not familiar with the environment that the stable teams actually are. And, well, you better ask that to some of the managers.
Well, this is exactly my point. This is exactly my point.
This is a question of lack of investment, not especially over the last decade. We've seen systematic withdrawal by George Osborne in the student nurse bursary. Now, that saved £100 million, but now some of our students from King's and elsewhere are saddled with up to £50,000 in student debt that they have very little chance sometimes of even repaying. So that is no way to start an adventure in a nursing career. And so I think that, plus what we've seen in terms of the international recruitment of nurses and increasing reliance on pulling in nurses from some countries that actually are on the red list for recruitment and are not being ethically recruited into the system, that's been a function of a lack of investment in the domestic sustainability of our workforce. And this has been going on for a long time.
But isn't part of the problem? But isn't part of the problem, Dame Anne, that basically the reason why it takes longer now to train nurses and it costs more money is because of the insistence that they should have a degree. I speak to many nurses from previous decades who say it's absolute nonsense. You don't need to have a degree in nursing to be a nurse. You didn't used to have a degree, and if you got rid of that qualification necessity, then you would be able to qualify more nurses quicker and cheaper.
Actually, countries which have had a longer established degree courses for nurses don't have the level of shortages that we do. Our entry into having nurses as graduates in England only started in 2013. In fact, we're a real outlier internationally in that regard. So, and our research has demonstrated that actually nurses who are better educated to bachelor's levels have better outcomes for patients. So actually,
yeah, but the system,
very good investment
but you've
for
admitted,
the taxpayer.
but you've admitted that the system doesn't work, right? So why won't you admit that the reason the system doesn't work is that it takes too long to qualify nurses? You've said many of them are saddled with debts that they shouldn't have, which is entirely due to them having to go to university to get a degree. So why not actually understand and admit that that system doesn't work for Britain? Because not everything works in every country the same way, as you know. So why not go back to the older system where you had a much better and quicker qualification process?
No, it wasn't quicker. It was a 3-year course as well.
Yes, but they worked in the hospitals, didn't they?
Well, they were part of an apprenticeship system, and we also have apprenticeships now for degree students, and that comes through a different funding route. The problem has been that the government has had a flim-flam, hot-cold attitude towards investing in students over the last 20 years. They've turned the tap on, then they turned it off. And quite frankly, that makes life incredibly difficult for universities. And the biggest constraint on student recruitment is actually the placements that we can provide in practice in the NHS itself. And so that is something which we wrestle and struggle with in universities. But
do you think it's right? Do you think it's right that universities should be making a profit while training nurses? Because I think they shouldn't. I think it's a taxpayer-funded endeavour, right? So the taxpayer should not be rinsed by these private university institutions that make a very, very fat profit, thank you very much indeed, off the taxpayer, training nurses, which they didn't used to do.
It's the same for any healthcare professional. Would you rather have no doctors, no physios, you know, no radiographers, no one trained in healthcare?
No, I'd rather no. Well, you didn't listen to my question. My question no, you didn't. My question is about the profiteering that's done by educational establishments such as yours.
Well, I think you'll find, actually, the facts are that many universities, and I'm not going to defend them because I'm not part of the Universities UK consortium, but actually that many universities are now struggling financially. And rather than being, you know, fat cats, they're actually in a position where they're financially compromised.
Well, maybe
they invest much more in higher education as in health.
No, maybe they could consider not paying their vice chancellors £600,000 a year, and maybe they'd make a bit more money. But finally, let me ask you this, Damon.
That's an exaggeration. That's a massive exaggeration.
No, it is not an exaggeration.
And you can take that point up with the Universities UK.
No, it is not. Well, if you'd pass that on to them, I'd be very grateful. Do you believe, Damon, that death for patients, because that's what's going to happen if there are strikes, is an acceptable price to pay to get wages higher for nurses and doctors?
That's a moral blackmailing question, and
it's
I'm not
real
going to rise to that bait. The fact is that when the strike was managed in Northern Ireland, there were no casualties. There are very, very strict rules known as derogations, where certain categories of patients are excluded and life-threatening and life preservation services are maintained. This is a very rigorous process, and it's highly and very tightly managed. So that's not...
Well, if only the NHS was tightly managed, we wouldn't have to have strikes in the first place. But there we are. Damon Rafferty, thank you very much indeed.